Ever wonder how your body sends signals? It's all thanks to your nervous system. But what happens when its protective coating gets attacked? Today, we're diving into two conditions that do just that, yet are worlds apart. Multiple sclerosis and Guillain-Barré Syndrome, they're often mixed up, but knowing the difference is crucial. Let's start with multiple sclerosis, or MS. This is a chronic, long-term autoimmune disease where the body's immune system mistakenly attacks the myelin sheath, a protective covering of nerve fibers in the central nervous system. That means the brain and spinal cord are the main targets. The most common type is relapsing remitting MS, where symptoms flare up and then improve. People might experience vision problems like optic neuritis, overwhelming fatigue, muscle stiffness, or a strange electric shock-like sensation down the spine called Lermit's sign. To diagnostic, doctors look for specific lesions called periventricular plaques on an MRI, and unique proteins called oligoclonal bands, and the cerebrospinal fluid. Now, let's switch gears to Guillain-Barré Syndrome, or GBS. Unlike the chronic nature of MS, GBS is an acute rapid onset condition. It's an autoimmune disease of the peripheral nervous system, the nerves outside the brain and spinal cord. It's often triggered by an infection, like from the bacteria Campylobacter. The classic sign of GBS is a ground to heels, ascending paralysis, starting in the legs and moving upwards. It can also cause a loss of reflexes and, in severe cases, affect the breathing muscles, requiring urgent medical care. Diagnosis involves looking for something called albuminocytologic dissociation in the spinal fluid, high protein but normal cell count, and nerve conduction studies that show slowed signals due to demyelination. So, what are the key differences? Let's break it down. First, location. MS attacks the central nervous system, brain, and spinal cord. GBS targets the peripheral nervous system, the nerves in your limbs and throughout your body. Second, the timeline. MS is a chronic, lifelong condition with a progressive or relapsing course. GBS is acute and monophasic, meaning it happens once, often with significant potential for recovery over weeks to months. This difference in timeline leads to very different treatments. For MS, the focus is on long-term disease-modifying therapies to slow progression and steroids. For GBS, treatment is urgent and aims to stop the immune attack, typically with intravenous immunoglobulin, known as IVIG, or a blood cleaning procedure called plasmapheresis. So while both MS and GBS involve the immune system attacking myelin, they are fundamentally different. They affect different parts of the nervous system, follow completely different timelines, and require entirely separate treatment strategies. Recognizing the warning signs early is key to getting the right diagnosis and management, which can dramatically improve outcomes. Thanks for watching, and remember to subscribe for more health insights.